All right. Hey, everyone. It's Dr. Tamara Beckford with Your Caring Docs, and this is our Docs Who Care show. That's right. So, today we are going to talk about something that a lot of people are going through. Some people are hiding, or you might feel a little bit ashamed, but that's okay. We're going to go full disclosure. And this is about eating disorder and canceling this diet culture, right? And we'll also be talking about managing or this whole high functional depression. And we are going to do this with this wonderful lady doc of ours, right? So I'm going to bring her in our Your Caring Docs fashion. So today we have a double doc. If you're looking at the degrees on the screen, you'll see the DMD and the MD. So let me just let you know about this wonderful friend of mine, right? So this lovely double doc, she went to dental school at the Southern Illinois University School of Dental Medicine. And then she went to medical school at University of North Carolina, Chapel Hill. She did residency in oral medicine, like that's OMFS, oral maxillary facial surgery. So those are our double docs out there. Shout out to all of them. She did that at a Carolina Medical Center. She's done multiple things. She's done research at MD Anderson. She's like a super person. She's a go-to if someone wants help, right? Absolutely. She is also a certified professional leadership coach, an advocate for cancer, like I said, that diet culture, and she's an advocate for mental health. Today, we will be discussing living with anorexia, burnout recovery, and managing that high functional depression. And then she's going to tell us why that term is misleading. Welcome, our wonderful double doc, Dr. Jillian Rigert.
Thank you so much, Dr. Beckford. And we can clearly say
hello.
I will take clear responsibility for my technical difficulties. So if
That's
you're looking for
okay.
help, that is certainly, and you'll notice my camera is probably not the clearest. So if we get a chance to do this again, we will have it figured out. I will have it figured out.
We are all good in the neighborhood. It's all good. We're just so happy to have you here. Alrighty. You know, all of our docs, they tell us how this all started. And that's what we're going to find out from you. So bring us way back to when you decided, you know what, I want to be a dentist. So tell us, how
Oh
did that come
boy.
about?
Yeah, well, I have a lot of the childhood stories where I started, was always playing doctor. So I knew
Okay.
something had to do in the medical field. When I got into undergrad, I was really interested in psychology and had, some feedback from my father, wasn't so interested in mental health, maybe consider something else. So a little bit backdoor way into psychology was dentistry, because we just think about so much of our identity is the way that we look. Our smile can really have a huge impact on our confidence and the way that we, present to the world. So I thought, that's a really great way to help people to become their best self by really focusing on giving them that smile that makes them really kind of tackle their goals and not hold themselves back.
Absolutely. Wow. I never thought about that. And you're so right. A smile really is a way into a person's confidence.
Yep,
All righty. So now you're there, but then you decided, listen, I'm going to go over into medical school because I'm not done. Okay. So tell us, when did that come about?
Yeah, throughout dental school, I just, it's been challenging when they separated dental school and medical school. I think that's done a disservice that I think, we are now starting to really realize it's important to bring it back. In medical school, you'll notice there's not a lot of oral exams being done. I laugh because when I was doing the medical school rotations, it's like, hey, there's a mouth problem. And I'm like, and hey, you, come with me and we'll learn this together. And then in dentistry, I had a really great undergraduate education in sciences. And so that helped in dentistry. But when you're thinking about the mouth, you really can't separate that from the human. That's true. So there's so many oral manifestations of systemic conditions. And I just found it so fascinating. I found I really liked that, problem solving. And then we also had we also had Air Force individuals coming and rotating in our school. And there was a lot of the oral surgeons, and just like, oh, that's so cool. And at the time, that was my understanding of the only dental specialty that allowed for more integrated medicine.
Wow. Wonderful. So now you're there and you're doing, your rotations and then you're going into the residency. But then there's something that you had underneath. Everything kind of took a toll and it all reached to that needed point. But there was something that you said that's been going on, and that was that anorexia. So can you tell us the story behind that?
Yeah, I was diagnosed with anorexia when I was in my adolescent years. As the first time it showed up, and I, when I first started having issues, if my natural body type is on the higher end of what we call the BMI scale, and I say it in quotes because I don't think it's the scale that we should use. So when I started having thoughts about losing weight to kind of feel better about myself, it was congratulated. And it was seen as a very positive thing. And I had that very, we think about the perfectionistic type of a personality,
Absolutely.
very high stress, high anxiety. And so the weight loss started as just like a, thing after puberty where you're like, well, I'm going to change my body because it changed and I wasn't ready for it.
Right.
And that quickly turned into something else. And at the time, this was about over 20 years ago, and people didn't talk about mental health the way that they do now. And so I didn't know what was happening. No one was really talking about it. And it would really just kind of spiraled into anorexia from my, just very benign wanting to lose weight. And then I realized it was helping me to control the anxiety that I was experiencing at that time. So again, the body changes. And at that time as well, my middle school had just migrated due to some issues with mold at a high school. So I bring that up because a lot of times eating disorders can show up as lack of control, or to gain control when you're feeling out of control a lot during transitional periods. So it happened, I was transitioning, my body was from puberty, and then all of a sudden I'm in a new school environment with new people, and it was just creating a lot of anxiety that manifested my coping skill was anorexia.
Interesting. And I like the fact that you're really highlighting that it really wasn't as much about the eating as it was about the control of something else that was deep, which is what's going around me that I had no control over. And you're feeling some anxiety. And you're just like, well, how can I gain control of this? The only thing that I can really think of right now, I was able to control my body. And that was your outlet for the anxiety, for the transition that was going on in your life. So you mentioned two parts of the transition. One, puberty, which I think is interesting, right? Because like, boom, it happens, your body's changed and you're not really sure, even though people are telling you, yeah, this will happen, but it's kind of drastic when it does happen to you, right?
Yeah. And no one told me, like no one, it wasn't, and this is something for the family. Like I wasn't prepared, and I was more of the tomboy, as very like into the sports. And so when I first went into puberty, and I didn't tell my mom for 2 years that I had a period, like I was like, nah, I'm kind of embarrassed, and it wasn't normalized for me.
Right.
And I was pretty early in the group of my friends, and it was very like not congruent with my personality type, again, being that like sturdy athletic person in my head, right? It was just like, this feels awkward. This doesn't feel in alignment with who I am, and I'm confused, and no one's talking about it. Again, I'm 33, so no one was talking about it back. Hopefully, I don't know if people are talking about it more freely now. Yeah, but
if not, we are, right?
We are. Yeah, we are. And hopefully that helps other people to feel very normal about it. And it's very precious for me now because my sister has 4 nieces, and I have one going through puberty now, and it's helpful for me because it's just so normal. And her ability to appreciate the changing body is so normal, and it's beautiful. And it's, just that extra layer of healing to watch a child go through that, and just to kind of remember back to I was not giving myself grace to make those same body changes, and just appreciating how beautiful the body is for, you know, turning into a woman.
Absolutely, absolutely. It is a beautiful and graceful period if you're able to go through it with the knowledge and support,
Mm-hmm.
especially if it's from people you love and those who are around you, such as your family. Alrighty, so now you're also mentioning through this time, we're talking about like, going through changes that are happening within your body, some of that you cannot handle yourself, you're not understanding what's going on, but you're trying to control this. But
Mm-hmm.
then now we also say that as things progress, you are talking about this high functional depression. Let's
Yes.
get into this
Mm-hmm.
term.
Yeah,
What are
that's
your
true.
thoughts? Okay, go ahead. Tell us about
Yeah. So I got this is all starting. I was not a depressed person when I
it.
was a child. My nickname was Silly Jilly. I'm such a goofball. And I know sometimes we can hide depression through being goofy, but I was
Mhm,
genuinely the happiest child.
mhm,
Despite the anorexia, like that to me didn't turn into depression. It was just
mm,
a way to control the anxiety. And fast forward to joining the Air Force.
mhm,
This is the first time that I had never experienced being in a position where I had no idea. Like I was not the top
mhm,
in knowing everything military. You know, people had entered it that had already had families, and so when I
mhm,
started officer training, I felt like I was stupid. Like I just like I'm like I don't understand these terms. We were
mhm.
being tested on ranks and things like that in terms of, you know, the enlisted structure, and I just at that time that perfectionistic tendency, like I should know what I haven't learned yet,
Yeah.
right? And I didn't give myself grace to learn it. I was like, I
Mhm,
should already know this. Like, I should not be scoring a B or a high B, right,
mhm.
on this Air Force exam. And I look back on it now, I'm like, oh my gosh, right? Like, but at the time, I was like, I'm not. What am I doing here? And I would look
Right.
around too, and I found myself really jealous of other officers, like in psychology. So I
Mhm,
was feeling that twinge of like, I don't know if I'm going into the right discipline.
mm.
And that was the first time I had really looked up and reflected on that. Like, this is where we hear about the arrival fallacy. This is when it
Yes.
started hitting me. Like,
Mhm,
I had just worked my tail end off to get into the Air Force, to get into oral surgery, to finish dental school, and I did not enjoy dental school. And so I was holding on, thinking that the combination of dentistry medicine would be it. Like, that would
right,
give me more enjoyment of the dentistry that I was doing.
right.
So when I had the time to look up and I was where I thought I would be happy and I wasn't,
Mm.
I was like, oh no, oh no.
Right?
Mhm. So this isn't great, you know, not great. And
Right.
so I was trying to save face and I'd be driving to work, like all these dark thoughts, like, you know, high anxiety, like I just kind of, you get that psych ache of like, oh, I just feel so bad. I
Right.
can't put a pinpoint in it. Like I can't put a name to it. I couldn't
Mhm,
identify that this was depression. I had never experienced it before. I just knew I was like not okay.
right.
And so I was going through the motions. I was a dentist at Lackland Air Force Base in San Antonio. And I was, you know, you have to save face and you're putting on the
Yeah, because you're taking care of
officer.
patients.
Yeah, you've got your patience, and I'm like, maybe this is confidence because that had shown up before, like self-confidence. Maybe if I just work on my confidence. And
Mhm,
it wasn't, you know, improving. So I went to a psychiatrist
mhm.
and he said, well, you've got all the symptoms of depression, but you're functioning quite well because at work I
Oh,
was, right?
right, absolutely.
Yeah. So he said, you have high functioning depression.
Mm.
And here's my brain thinking, oh, good. He thinks I am perceived to be functioning high. I was glad at that time that
Ah,
was given to me. I didn't
uh-huh.
take a step back to be like, I wonder if maybe I'm censoring just how poorly I'm functioning at home.
Wow.
And I think that now, like, it's taken many years for me to reflect back, like, what was it about that I really needed to save face? And if I had depression, it might as well, I have to have at least high functioning depression. And
Right.
how is that even like the whole point of depression is you're not functioning.
Wow.
So
Did you think that getting the diagnosis of being like high functioning depression made you feel like, well, ooh, at least I'm not bad because it says it's high functioning.
exactly. Yeah. And I didn't even consider it a mental health illness, even
Ah.
though I was having suicidal ideation. I was like,
Mhm.
oh, okay, well, I'm functioning. So I must be fine. Like I must be
Not only you functioning, you're high functioning.
high functioning. Yeah. So
Yeah.
A
So that means
plus, A
I'm at the
plus
top.
depression, right? A plus.
Yeah.
I'm getting an A plus in depression right now. And I say it lighthearted, but that's what it was. I was like,
Yeah.
okay, you know, and then I noticed at that time was like, I noticed the eating disorder behavior starting to creep up because
Mm.
I didn't know how to fix depression. I had not experienced it before. I didn't have the answers. So it's kind of like your favorite pair of jeans, right? You grab them again. So I went back for anorexia, not on purpose by any means, but it was something familiar. And it
Right.
numbed me out before, and it gave me that sense of control before. And it's like, what happens with eating disorders is like it kind of, for me, it kind of crept up on me. It's like you start to take one thing out, and then you feel better, and it's an illusion of feeling better. You feel like you're in control, and really you are out of control. You are getting further and further out of control, but it feels so good from the way that my brain works. It's like it felt good, even if it was short term.
Right.
And at that point, that depression was, you're not thinking long term. Depression is like, the apathy of long term at that point was non-existent. So
It's a right now, I did this. I feel better. Wow, good. I'm feeling better. So I'm going to do
exactly.
more of this.
Yep.
I'm feeling more in control. Oh, well, this is And do you feel as if your brain was telling you, wow, yes, now we're feeling better. Maybe we're no longer depressed. Did you feel that way as when you were not deliberately making those decisions for the anorexia, but it was creeping itself way back in and you got that control? Did you feel that that control made your brain think that, okay, well, now I'm starting to feel better?
Yeah, for sure. And it also was that I was hoping it would just go away because
Ah,
I knew getting help in the military and in medicine is like, I'm just hoping this goes away, and to admit what you're truly feeling, like, what would that mean for my military and medical career?
absolutely.
So the culture is such that I was just hoping, and you're like, you restrict in your head how severe it is. I think that part denial is like saving you from the repercussions also of like, if I'm honest with myself, that means I'll probably be honest with the provider. And then what would that mean for my career?
Absolutely.
Mm-hmm.
Absolutely. Wow. So now we're continuing along and you're finding yourself more in the state of the anorexia. And then you decide to get help. So how did that look like
Yeah.
when you gave in and said, you know what, wow, I guess I do need this.
Well, this was so in 2013-14 is when I got diagnosed with depression.
Mm-hmm.
And I met with the oral surgery board and I said, I don't know if I should continue on with this surgery because I'm getting severely depressed, long hours, the high risks surgeries. I'm like, I don't know if this is right for me.
Mm-hmm.
And we had talked together and they said, maybe it's just the hierarchy, the way that the military surgical residency is. Maybe it's your confidence. And I said, okay, and again, arrival fallacy. Well, maybe when I'm in my civilian program, it will be better. So the eating disorder at this point, my weight was fine, even though with anorexia, like clearly the same as I had experienced before when my weight was suppressed. But because I looked fine, I wasn't forced to get help.
Okay.
And I was also not accepting that I was sick in that standpoint yet. So my lack of getting help in terms of very intentionally being like, okay, this is not okay. I need to pause. I need to not continue. I think it was just, I was reassured that I was doing okay, that I was high functioning,
Okay.
and that it's just my confidence. So I went into the oral surgery program at UNC, which is such a great program. And what happened to me was then it reaffirmed that it's not the program, because if there was a program that was good fit for me, it would have been that program. It was for my personality, just such a strong fit. And so it allowed me to realize, no, it's the profession that you've just entered is not a good fit for you. And the way it wasn't a good fit for me is the way that my brain could not tolerate that forced sleeplessness. So I could do the surgeries just fine. So I had been on call multiple times in a row and was so sleep deprived that it felt like my brain was hijacked, that it was no longer my thoughts. Like I was like, oh, these thoughts are crazy. Like, what the heck is happening? The severity of my suicidal ideation was intense. And I was like, is this normal? You know, this was 2014, and I felt like I'd never heard the term burnout before. I'd never heard people talking about it. So I looked around. Everyone looks like they're functioning great. I'm like, well, no one else likes call, so I'm not going to complain.
Right.
But there was a night where it was 3 a.m. ish, I think, and I was waiting for an OR. We kept getting bumped for red traumas. And I look at my 5th year, and I say to her, do other people experience like dark thoughts on call? Because I'm like not okay. You know, every time I'm on call, I'm not okay. And she didn't say much at the time. But the next day, my program director had called me in to talk about it because she at least had alerted him. And I'm so grateful for her. For like, you know, I don't know how I came across, but to not be able to say something to a person that's in that asking that question is understandable.
Right.
And so my program director is awesome. I still talk to him to this day. And he's just like, you know, you're a person first. So we're here for you. Like, what's going on? Like, I can't even explain to you what's going on. Like, I'm like, my brain just feels so bad. Right. And I'm not okay. And then and then you go out, you're crying in the office, and then you go out and you see patients, like, you know, and I would go into the clinic, see a patient, and then I'd go back and like breathe, and then go see a patient, and then go, you know, and like multiple times just trying to get space to breathe. And I just like, this is not sustainable. But I had gotten into my therapy at that time, and I remember my thoughts were like, I need to either finish oral surgery because I committed to this. I am committed.
Right.
Or I'm going to end my life. Like that was my two options, very clear cut. And I was like, I gotta do this. And the psychologist goes, or what? I'm like, or what? You know?
You're like, there are other options?
Yeah. Like, or what? What do you mean? You know? But I think with the threat of your medical career ending for a huge transition like that, I just was like, no, I have to power through this. I loved the Air Force. I don't want to let them down. I knew going back to dentistry would mean I was deployable, and I wasn't mentally okay to do that, but yet also not prepared to ask for help in like a very intentional way to say, hey, like, yeah, I'm back. I'll do dentistry. And I also need mental health support. I was afraid that was going to lead to a discharge because I had gotten a medical waiver to get into the Air Force, and I had only gotten that medical waiver in my mind because I was going into oral surgery, which was a high need.
Okay.
Versus dentistry, they already were at capacity. So I thought if I went down to dentistry, not down, but if I went back.
Transitioned from your oral surgeon to the general dentistry.
Yeah, that they would no longer need me enough to keep me. And so I thought at that time, like, I'm going to just keep going. You know, I'm just going to keep going. I did end up, so in oral surgery, we do anesthesia.
Yes.
And that's when my thoughts were getting more and more real because you have high risk medications in your pocket.
Yeah.
And not to go into deep detail because that's not helpful for anyone, but just when you have access, you need to get help.
Absolutely. Right.
So I called the program manager of oral surgery and I said, I think I need to take a medical leave. And he said, when? And I said, days or months ago, but I'll settle for now.
Right.
And he was so like, he got it. You know, I was fortunate that he was a receptive person that had understood it. And I was on medical leave the next day.
Wonderful. Now, I know that you and I have talked outside of this particular conversation. We've had other conversation. And one of the things that we talked about was the face of eating disorder.
Yeah.
You know, that when people think of anorexia, they really just have this prototype in their mind. However, when you were there getting help, you saw people from all over. So let's
Mhm.
just discuss that so that people can understand this is not something that just fits one prototype. This is something that fits many. And there are many people out there who are dealing with this. Some might not want to acknowledge, but hopefully, with us talking about it, they can seek help.
Yeah, absolutely. And I'm not, I don't take for granted the privilege that I had access to care, even though it was delayed. It was early
Mm-hmm.
in my life because I did at that point fit a stereotype.
Mm-hmm.
And in acknowledging that I fit that stereotype, I was observant to the people that weren't getting access to care or were so delayed in their diagnoses. And
Mm-hmm.
what really stood out to me is anorexia, eating disorders look like anyone and everyone.
Mm-hmm.
And we're doing such a disservice. I also think the disservice is in the weight-based criteria for diagnostics.
Mm-hmm.
Thankfully, things are changing. I think we need to remove anything weight-based because, as I mentioned earlier, my eating disorder didn't start when my weight was suppressed.
Mm-hmm.
It just was prolonged because they waited until my weight was suppressed, which is a huge burden in diagnostics and also in insurance.
Mm-hmm.
And then what you're mentioning too is when I was in treatment last,
Mm-hmm.
there was the whole spectrum of faces.
Right.
So men, women, boys, girls, all different body sizes, similar thought processes, eating
Mm-hmm.
disorders and mental health, coping mechanisms.
Mm-hmm.
And the sooner we can appreciate that, the better.
Absolutely. Absolutely. Wow. This is definitely a very powerful story. And, I really appreciate you coming on and bringing light to this because, as we said, there are so many people who are going through a lot of mental issues, and then this high functioning depression, which is it's a newer term. I feel. I mean, I haven't heard about it until a little bit more now. And then we're seeing in the news, we're seeing.
Mm-hmm.
I mean, recently we just had the loss of Chesley,
Yep.
Kirst, who to the world looked as if everything was fine, but she was obviously dealing with, depression, but the world thought that everything was fine. So I really applaud you for stepping out and highlighting the depression, the eating disorders, and then also this now counseling of this diet culture. Now let's talk about that. Like,
Oh my goodness, diet culture. So, diet culture,
mm-hmm.
how it feeds into eating disorders and what have you. I will say 20 years ago, it was a lot more obvious to me.
Mm-hmm.
And then as I progressed in life and diet culture was very, pervasive and obvious, what stood out to me is that it was more gray. I was no longer clear cut having an eating disorder and not because diet culture creates normalization of eating disorder behaviors. So I
Mm-hmm.
think people have a harder time acknowledging to themselves. I hear it often, even myself. It's like, is this a problem because it's so normalized? And
Mm-hmm.
my problem with diet culture, unpopular opinion, is that it is very oppressive. It
Mm-hmm.
capitalizes on people's vulnerabilities. It makes us feel shame about our wonderful bodies. And when we feel shame, so if you have emotional eating habits where you feel shame and then food makes you feel good, or
Mm-hmm.
food doesn't make you feel good, so you restrict, neither of those are going to get to a positive outcome of whole wellness,
Right.
mind, body, spirit. So I just have never seen diet culture like really create this really positive impact on people's lives. So that short-lived, I am so disciplined,
Mm-hmm.
I am killing it in the gym. Like really, I've been there.
Mm-hmm.
I've been there. And it's like, we get to this point where that hyper disciplined mindset becomes very destructive. And what I'll mean by that is like I
Mm-hmm.
became so rigid in my thinking. It's such a fixed mindset. And
Mm-hmm.
I've had to combat that. And every time I come out of a treatment, it just is like I'm hyper aware of the detriments of diet culture because everything I have to do
Mm-hmm.
is anti-diet culture for my own healing. And I'm like, if every time I leave a treatment, I have to like breathe through diet culture. I'm like, this is a systemic problem that really needs to be addressed.
Wonderful, wonderful. That's wonderfully put. You're right. When you're really, there's a difference between enjoying what you're doing, being healthy, but like you're saying, being whole, right?
Mhm.
Healthy as a whole and not being rigid, restrictive in either direction. There's this balance, and that's the balance that the whole balance that one has to achieve in order to really to stay healthy mind, body, and spirit. So
Yeah,
wonderfully
absolutely.
put. Wonderfully
And I'll say for the diets, they're always very restrictive
put. Hmm.
in mindset. Even if a person hasn't yet restricted calorically, it's a
Hmm.
mindset thing, which can set you up for a binge because the more, even like the more I tell you you can't have something, what do you know, how much do you want it? Even if you didn't want it before,
More.
right? And
Absolutely.
yeah, so always would ask why, because that was what really last year, I was really struggling last year. And
Hmm.
that was the point that really was the most helpful with healing, was like confronting the lies of diet culture and being like, why do I keep getting sucked into this trap? Like, what, I know the outcomes are negative and here I am again.
Hmm.
And I have just developed this strong compassion for the body, and I'm helpful. I'd love to help share that with other people. And in
Absolutely.
doing so, it's like I no longer tolerate what diet culture says, but then it translates also into your work or your relationships. It's like I no longer tolerate the crud that my brain tells me. And
Absolutely.
therefore, I will no longer tolerate the oppression others are trying to put me in. And so I just think it translates so much, not only into what we eat, how much we move, but
Mhm.
into our whole life.
So wonderful. So, in really understanding, realizing the restrictiveness that you've placed on yourself, then you start to recognize that same restriction in other aspects of your lives. And
Absolutely.
then it becomes freeing. And like we said, it brings you more to that whole person, right? Where
Yeah.
you're more centered overall.
Yeah, absolutely. I saw it play out in so many ways, just devaluing myself.
Mm-hmm.
And my degrees, I was applying for interesting jobs. I was just like, where's the disconnect? What am I doing?
Mm-hmm.
um and I wasn't standing up for myself. And it's like, the more you stand up for yourself, the more we're just not tolerating any sort of crap that's getting in the way. And I mean, I think that's the most scientifically correct word for it, is crap.
Mm-hmm. Wonderful.
Yeah.
Well, it comes out after at the end of every meal. Wonderfully put.
Mhm.
Alrighty. So now that we've talked about all of that, now we're back to self-care, and which is a part of things that you're doing. So what are you doing now for self-care? And for those who have probably been on a similar journey to yours,
Mhm.
let them know what you're doing, and maybe this can be something that they can incorporate into themselves in their lives.
Yeah. Well, I think the first thing is just trying to reconnect with yourself,
Mm-hmm.
because in I had to pause. I was having a restrictive eating disorder. I had very compulsive exercise tendencies, so
Mm-hmm.
I had to first redevelop a relationship with, who am I,
Mm.
what do I want, and how do I want to present myself to the world.
Right.
Because when those things are in alignment and you find movements you enjoy, you
Mm-hmm.
appreciate yourself, so you nourish yourself in a way that makes you feel good. I
Mm-hmm.
think even exercise, diet, routine alone, it's like aside, starting it there. And that sounds like woo woo, but it's also the
It's
honest truth.
true.
Is like, if I hadn't, we get so dissociated for so long from
Mm-hmm.
ourselves, with
Mm-hmm.
all the different responsibilities that we have, that reconnecting can be that first step to really breathing. And then
Wonderful.
you've got that stability and that grounding to conquer the world.
Wonderful. Wonderful. So a wonderful part of your self-care is reconnecting with
Mhm.
Jillian. Is this
Yep.
still silly Jilly?
I'm more and more coming out that way. Yes, absolutely.
Yes.
People are like, you sound like your normal self again. And I'm like, at this point, I've just embraced, yeah, absolutely. A little bit weird. And
That's who I am.
that's who I am. Why be
Wonderful.
normal? That's boring. So
Why be normal when you can be you, which is
yeah,
a
it's
wonderful
just,
version of
what
everything.
is, yeah, what is even normal, right? We hear average
Absolutely.
normal. Like, what is that? I don't even know. Like, just be you. The world
Uh-huh.
needs you. Like, nobody is more perfect at being you then you.
Absolutely. Absolutely. Love it. Love it. Love it. Alrighty. So now we're on to our fun question of the day. All right. So if you weren't dentist, oral surgeon, Jilly from the block, what would you be?
Yeah, well, I will say one thing is that my specialty, I transferred out of oral surgery. So I'm an oral medicine provider. Therefore, if anyone needs oral surgery, I'll refer them somewhere, but I'm an oral medicine provider. And I also have been enjoying writing. So I have a cup here. It says, what would Brene Brown do? So,
Isn't
and
Brene Brown just down the street from us? Because
she,
we're
you
in
know what? I
Houston.
moved to Houston and I said, I can't wait. Brene Brown's probably so excited to meet me. Obviously kidding. I'm not grandiose by any means, but it's my joke because I think it's calming if you want to meet somebody that's very well known to just be like,
Absolutely.
I think they just can't wait for
Them to
to
meet me.
meet me. And so,
Absolutely.
yeah,
So
what I would
hello,
do
Brene.
is
We're just saying hi, but hey,
hi,
we're
just
down in Houston
Brene.
also.
Yeah, I know you're watching, Brene. So if I, I think, and it's even to a point where we're always thinking not only like if I wasn't a doctor, but yes, I am, and what would I do in addition? So I
Yep.
would love to collaborate or just hang out with Brene Brown.
There
I'm
we
very
go.
interested in writing, so if anyone finds any part of my story fascinating, maybe it will become sort of writing. But I love, children's books or fun things. I think Dr. Poe from Kevin MD's are probably going to get sick of me for submitting my writings there.
We've been
So
submitting a
we'll have to
lot.
look for a new way to become a writer. So I would be a writer and get back into acting. So
Oh, wonderful. Okay.
yeah, I would get back into acting and make sure that no one feels they have to suppress their weight in order to be on camera.
Boom, boom, boom.
Mhm.
Love it. Love
Yep.
it. Alrighty. So now we're here. And I know that those who are watching, those who are listening, they're like, wow, I love this. How can I get in contact with her? Because you're doing the coaching, you're really there, you're helping with leadership. You have the degree and the certificate to help leaders. So let them know where they can find you.
Yep, I have my own coaching. It's JillianRigertCoaching.com. You can read my blog. It's completely free. The other writings that we've been discussing about are on Kevin MD. And then, of course, LinkedIn and Facebook are great ways to get in touch.
Wonderful, wonderful. So we have a wonderful thank you, Dr. Jeannie Lawrence, who is our psychiatrist extraordinaire, who did come and tap in about depression, especially in our what we said the high functioning people. So she was watching and she gave you a very wonderful hello, Dr. Jillian Rigert.
Oh, perfect. Great.
Yes, yes. So thank you all for watching. I hope that you enjoyed today's wonderful discussion on eating disorders, what it looks like. You know what it looks like? If you look in the mirror, it looks like all of us. That's important. Right? We talked about depression and also high functioning depression, why it's still depression. So we still need to think about it, get help, and ensure that we're taking care of ourselves, mind, body, and spirit. And it really starts with self-care, right? Getting in contact and getting to know you better. What do you like? What do you not like? And what will you no longer tolerate, right? Which is all a part of that self-care. Thank you so much, Dr. Jillian Rigert, DMD,
Absolutely.
MD, extraordinary leadership coach, and also one who's out here helping us to cancel that diet culture. Thank you so much for
Absolutely.
watching, everyone. You guys have a
Thank
wonderful day.
you.
We'll see you guys next time. Bye-bye.
Thanks so much.
My pleasure.